vision.
Doctors in Miami will attempt to remove a basketball-sized tumor from a 14-year-old boy's face after doctors in Cuba refused to perform the surgery. What started as a pimple on the side of Emanuel Zayas' nose 2 years ago has since grown into a gigantic mass that threatens to snap his neck if it grows larger. At its current 10-pound size, the tumor, which is benign or noncancerous, blocks Emanuel's trachea and makes it difficult for him to eat and swallow. As a result, he's malnourished. It also blocks his vision. Emanuel, who lives with his parents in Villa Clara in central Cuba, arrived in Miami on a medical visa roughly 3 weeks ago, the Miami Herald reported. His parents, Noel Zayas and Melvis Vizano, visited numerous doctors in Cuba, none of whom would operate on the boy. He was born with polyostotic fibrous dysplasia, a rare disorder that causes his body to develop scar-like tissue instead of bone, leading to fractures and deformities in his limbs, according to the Mayo Clinic. "I knocked on a lot of hospital doors," Noel Zayas told the Miami Herald. "I thank God that we're here to see our son deforming, and all we can do is watch. It's not easy." Dr. Robert Marks, chief of oral and maxillofacial surgery for the University of Miami Health System, and a team of doctors will perform the surgery. "It's life-threatening by its very weight," Marks said of the tumor at a news conference at Jackson Memorial Hospital Friday. The operation will take place on January 12 at Jackson's Holtz Children's Hospital. "If nothing is done, it will cause a fracture of his neck," Marks said. An American missionary traveling in Cuba met Emanuel and presented the case at a medical conference. "Nobody knew what it was," Marks said of his first reaction to the X-rays and photos of the boy. Marks estimates it will take about 12 hours for surgeons to remove the tumor completely. The 9th grader will then undergo reconstructive surgery to restore his facial features. Marks and his team will perform the surgery as volunteers. "We're doing this because how can we not help this young man?" he said. After the surgery, Emanuel is expected to be able to eat and breathe much more easily.